Good afternoon, everybody, and welcome to our Share and Learn in Nottingham City ICP. We're delighted to host this today, and we're obviously having a focus on flu, so a really warm welcome. Our Share and Learn is going to follow the usual format where we'll have a short presentation for just under 20 minutes, and then we're really keen to take your questions, which we would invite you to post, and we'll be having a look at those questions, and then we'll obviously be able to answer. So my name's Tracy Tyrrell. I'm one of the Deputy Clinical ICP leads, and I'm joined this afternoon by a colleague of mine, Dr. Hussein Marji. So I'll just let Hussein introduce himself.
So my name is Hussein Marji. I'm a GP at the Victoria and Mapping Practice in the City Centre, and I'm Joint Deputy Clinical Lead at the City ICP with Tracy.
Thank you, Hussein. So Hussein and I are going to lead a short presentation, and as I say, we're really keen to hear any questions or comments or areas actually that you feel that we should reflect on in our approach to flu. So thank you. So we'll go to the next slide, please. Lovely. So we just really wanted to start off by explaining why the focus on flu. So as we've introduced ourselves, both Hussein and I work in the ICP space, and obviously we're very committed, as our colleagues are around that ICP, to think about how can we improve the lives of our citizens across Nottingham City. We know that we've got high levels of deprivation, and we know that that brings around challenges. Around obviously people understanding and taking up the offer of flu vaccination. So part of our priority setting around our ICP was around increasing the number of people receiving flu vaccination. So it's really important to us that we do this work, and that's been a priority for the last 2 years. So next slide, please. So to do that, obviously what we've done is we've worked with a number of collaborative partners across our ICP, thinking about how we can do this differently and joined up together. And on this slide, you can see some of those partners. So we've got City Care, which is our community healthcare partner. We've got Nottingham University Hospital, our acute provider. We've obviously got our clinical commissioning group, and really importantly, our ICP communications are a really key part of this. We've got public health, we've got our lottery programme in the city, which is Small Steps, Big Changes, focused on young people. And then we've got NHS England, and really importantly, we've obviously got our primary care colleagues of both GPs and practice nurses. And our aim really is that we look and work together. So we believe that by working together and working jointly, we can really bring about a sustainable change, and we can do things that are different and outside, and that they're creative and can really address how we can work effectively so that we can really improve our flu vaccination programme. And by doing this, obviously, we can really work together by thinking about our skill sets and our strengths. Rather than perhaps sometimes traditionally we may think about our contracted activity. So really thinking about together that collaborative approach to really working effectively. And in terms of, I suppose, how we're doing this, we've got 3 working groups, and they're obviously there. Next slide, please. So we've got our pregnant women, our 2 to 3 year olds, our school-age children, and then people under the age of 65 with chronic respiratory disease. And we've got targeted groups that both Hussein and I lead and provide some leadership to in our Deputy ICP clinical lead roles to really think about how we can drive forward the agenda. Next slide, please. So what we wanted to do today was really just share with you a little bit about some of the work that we are doing and have been doing and what we plan to do. And as I said at the beginning, we're really keen to hear your views through the questions about what we perhaps can do differently, or ideas that you have, or any questions about our approach to flu this year. So obviously for all of those cohorts, we know that by having that collaboration through that task and finish group, we can really work to the maximum, and we can really think about how do we reach the diverse needs of our population in the city. And we know that across our PCN areas, we've got very different groups of population, and so we need to think about some different approaches. We know that our communications plan is really critical. So how we communicate, both in our written word and in our verbal word, and how we actually think about some of the platforms for communication, such as our local radio stations, but also about actually the identification of me in our communications plan. So we've really tried to do some posters and some communications that are really targeted to individual need across our city. We've also successfully over the last 2 years tried to showcase some case studies in the pregnant women group. Last year we had some case studies where people who were healthcare professionals and were also pregnant were able to talk about their experience and why they'd taken up their flu vaccination offer. And again, we're just working on those for this year. We've put some areas in our IT technology, such as System 1 pop-up, and we've done that in City Care, so that we've got a reminder with the practitioners to be able to discuss flu. So actually, when we're going in and having those interventions and providing care, we can actually then use that opportunity to really discuss flu and the importance. And we've also done that in our acute trust as well. So that's been done through Nerve Centre in Nottingham University Hospital. So again, it's that patient record prompting that we're giving that flu vaccination advice. And then in our general practice, obviously there's been a real identification of flu champions. So again, having somebody who really champions flu and the reasons for the vaccination across their colleagues, but also across the people that they serve. Next slide, please. So I'm going to hand over to Hussein to talk a little bit about some of the work that we're doing in our under 65s.
Thank you, Tracy. So we chose to work with the under 65 with chronic respiratory disease for a number of reasons. This is a significantly large cohort of patients in the city. There are about 19,500 patients under 65 with a chronic respiratory illness. And in previous years, we've seen flu uptake a little bit below 50% in this cohort, and we know that flu particularly affects those with respiratory illness as well as those with other comorbidities. So this is one group that we chose to target last year and again this winter. We've specifically provided some targeted campaigning in terms of communications and posters and media messaging to try and target those groups who are the most vaccine hesitant, including young people, including our BAME and other ethnic populations, and making the point that even though you're a young, fit, healthy asthmatic, for example, influenza can be severe and it can cause pneumonia, it can cause death. And so we've tried to target our messaging in a way that really reflects the seriousness of having influenza. We've been very fortunate to engage with our rough sleepers to understand the barriers that they face in terms of accepting a vaccination or indeed accessing a vaccination, and ensuring that they're able to register with a GP practice and access better healthcare in that regard. And we've worked with the Homeless Health team to ensure that we can vaccinate patients through the Wellbeing Hub, which is on Houndsgate. Our City Care colleagues have been most helpful here in that they look after a cohort of housebound patients or homebound patients who have respiratory illness and who are aged under 65 years, and they have supported us with vaccinating that cohort, as obviously there's significantly more work in reaching out to the housebound in this way. We have worked with colleagues at Nottingham University Hospitals Trusts to ensure that any outpatient clinic letters that go out to patients promote flu vaccination, particularly in those cohorts that are vulnerable. And we've conducted some case studies in patients with COPD to demonstrate their journey and how that's been helpful to them. And on the slide, you can see an example of one of the posters that we produced, and you'll see a few more throughout the presentation. Back to you, Tracy.
Thanks, Hussein. Next slide, please. So what are we doing with our pregnant women? We absolutely know that this is a critical area of the population that we need to reach. And we've been working obviously with our health visitors who currently have an antenatal visit or call. And so as part of that antenatal visit or call, telephone call, they've been having a conversation about the importance of having their flu vaccination. So that's been something now that we've done for 2 years, and we found that that's been really beneficial, that conversation. The feedback from our pregnant ladies is that they've found that really helpful to understand the importance and really to have that opportunity to engage and understand why having the flu vaccination is so important to them. Obviously in our NUH, our hospital, our antenatal clinics, both at City campus and Queen's campus, have a vaccinator available to the clinic. And so they're able to offer the flu vaccination there and then, which we know that is really helpful. And also our community midwives who work with our pregnant ladies in our community settings have a list of nearby pharmacies, so they can actually signpost ladies to those pharmacies so that they can get their flu vaccination. And we've also done some engagement through our Small Steps, Big Changes programme, which, as I say, is a lottery funded programme in the city, which is focused really on children, young children and families. And we've done some engagement there with our pregnant ladies about what matters to them and what may be some of the barriers for having the flu vaccination programme or not. So that's just some examples. And again, you'll see there a poster. So the next slide, please. So again, what are we doing with our 2 to 15-year-olds? We've been doing some videos and communications going out to parents, advising around alternative vaccinations. We absolutely understand that people have different needs and will not sometimes we'll need to explore what the vaccination is comprised of and then be able to make a choice. We've also been printing off information and posters to our nurseries and preschools. So again, really spreading that message about flu vaccination and why it's important and being able to offer some advice and expert advice. And then our school-aged immunisation service has been doing work and continues to do work around supporting obviously the programme of delivery, visiting schools, supporting consent, thinking about how we can obtain and access and have those conversations, and then also using some new communications resources which has come about from our engagement. Next slide, please. So I'm going to hand over to Hussein to talk about our data.
Thank you, Tracy. So the slides that we have in front of us, they cover the 3 cohorts of under 65s with chronic respiratory disease, the pregnant women cohort, and the 2 to 3-year-olds. And what we're looking at is in the large slide, for example, progress at weeks 40, 44, 48 and 52 throughout the season. And the purple bars are what we achieved last year, and the green bars are what we've achieved so far this year. So at week 44, which was I think last week, sorry, the week before last, you can see that we have achieved a bit more in the under 65s with chronic respiratory disease compared to previous years, but clearly it's a work in process and we are mid-season. Unfortunately, we've seen in the pregnant women cohorts and the 2 to 3-year-old cohorts that we haven't got quite as good uptake in both of these groups. And we think there are a number of reasons why this might have occurred. We know that a large number of GP practices this year had significant delayed deliveries in their flu vaccinations, and so their flu vaccination programs are perhaps a little bit behind where they are, although they are catching up significantly. And we are working with those practices who are finding it difficult to achieve the uptake they've had in previous years. And again, with the 2 to 3-year-olds, we're slightly below, but we are very much mid-season. This is very much a work in progress. These are live figures, and I'm very hopeful that in the pregnant women cohort in particular, we will catch up with what we achieved last year, which was a significant improvement on previous years. So back to you, Tracy.
Thank you. Next slide, please. Yeah, so this slide shows year-on-year comparisons. So we'll go next slide. Okay, So I think we just wanted to take this opportunity to think about all of us. We've all got a role. Obviously, it's great that we've got people here joining us today, but we've all got a role. So if we're obviously part of a care delivery service, or if we're part of one of our voluntary sectors in our ICP, we really are asking people today to just think about the importance of flu vaccination, both for yourself and for those people that you serve in the Nottingham City ICP, and really using any opportunity that you're in a household or you have contact to really just remind and discuss really whether people have had their flu vaccination, and take a moment to think about, could you actually offer any practical support? We're asking some of our colleagues who provide care to think about how they can include the importance of flu vaccination in their letters. So if you're sending out letters to your patients, to think about whether for those eligible patients, whether actually we could have a message in there just about promoting flu vaccination programme, and we can help you with that. So if anybody's interested in taking that offer up, then obviously we can help you and provide some written sort of wording that would help support and signpost. For our GP colleagues, we know, as Hussein said, we are all working incredibly hard on this. So one of the things that we've discussed in our Pregnant Women Task and Finish group is about that we're going to start to think with our GP primary care colleagues about whether we want to call our patients, and again taking that opportunity to promote. So that's something that we're working on, and we're working on a script so that we can have an informative script that really promotes and advises. And then really lastly, and I've probably said this at the beginning, but just really making every contact count. So thinking about, are there opportunities when you're in front of a patient where a flu vaccination could be available, or you could signpost to one of the nearby pharmacies. We know that sometimes when people are with us, there's a real interest to have their flu vaccination, but we absolutely appreciate people have very, very busy lives. So it's about thinking about that opportunity and whether we can deliver that vaccination. So next slide, please. So there's some key messages, and we can see that some of these are coming up in the chat. So we just wanted probably just to explore some of those myths. So you don't have to wait to have your COVID jab first, or vice versa. You can have your COVID and flu jab on the same day or in the same week. And also really important today, one of the key messages we just wanted to probably end on is that you can have the flu virus but have no symptoms. So actually you could still pass on that flu virus to others. So again, just for us all working in our ICP, we hope that those are helpful facts for us all. Next slide, please. So there are some resources and communications material that's available, and again we can issue these out for anybody who's interested after today so that you can access them. Okay, next slide please. And for us, what we really want to do, and we just want to end on this slide, is that, it's really important. We want to serve our City ICP population well. So we want to do our very best. And so after each year, we will hold a learning event. We want to listen. So we want to listen both to the people we serve, but also our health and social care and voluntary sectors. We want to use our data to drive change. So Hussein's obviously shared that data with us today, and it's something that through our task and finish groups we look at regularly, and we think about, so what's that telling us? What does our approach need to be? And we want to maximise the opportunities to work differently. And for us, obviously, success has to be that we improve year on year the flu vaccination programme. So thank you, and I hope that's been informative, and we're going to now stop sharing the slides, and Hussein and I are going to take some questions. So I'm just looking at some of the questions, Hussein, in the chat box, and I can see that we've got some questions about about new low uptake cohorts emerging. I know you've popped an answer in already, but I just wonder whether you want to sort of talk to us a little bit about those, what approaches we're going to be taking.
So yeah, I think it's very challenging, and we know that it's very likely that we'll see some variability on last year's performance week by week, and some weeks we might be a little bit up, some weeks we might be a little bit down, but we're aiming overall to be on the up. I think patients are very fatigued. I think there are a lot of patients that are very fatigued with the vaccination schedules and going to get their COVID first, second and booster doses. And for some of those patients, having a flu vaccination might not seem like such a priority because they perceive flu as not being quite so dangerous. So I think it's really important that we do get that message out there that not only can flu be very dangerous to the individual, particularly if you are more susceptible, and pregnant women, children, and the chronic respiratory disease under 65 cohorts are particularly vulnerable. But even if they are well with influenza, they can pass it on to their family, their friends, their loved ones. And I think that's a really important part of the messaging. And we have seen that message accepted by many people with regard to the COVID vaccination. So I think we need to draw on that capital to try and support the programme. And we also want to do some targeted work with particular neighbourhoods where they have challenging populations who are very vaccine hesitant, very vaccine concerned, to ensure that we get the messaging out there that flu vaccination is safe, it is appropriate, that our Muslim colleagues can have the vaccination because it is acceptable under their Sharia law and guidance. So we're doing quite a lot of targeted work with neighbourhood populations as well.
Thanks, Hussein. And I think it's really important, isn't it, that we do this. We really need to listen to our populations, don't we, and think about how we can engage and how we can get that offer out to them. We probably haven't had that many other questions. I can see that we've had some questions around whether it's safe, and I can see that you've answered that, so thank you for that. And we've also had a question about somebody who's never had flu, so therefore hasn't felt the need to have flu vaccination, and you've obviously explained, I mean, we're pleased that they haven't had flu, but it's still really important to get that vaccination. I think we're being asked, so we've been asked around what's the difference between a cold and flu. So I'll probably let you answer that, if I may, Hussein. Yeah.
That's fine, thank you, Tracy. So there are many viruses that we experience over the winter months, and the cold virus is a different virus to the influenza virus. So with the common cold, people feel a little bit unwell with a little bit of temperature, runny nose, perhaps cough and cold for a few days. Influenza can cause identical symptoms, and with some people they will only be mildly unwell. But there are two problems, and as I've said, some people will be very unwell, and it can cause pregnant women to have low birth weight babies or to miscarry and lose their pregnancy, and it can cause pneumonia and death in vulnerable patients. So we want to prevent anyone that might be vulnerable from getting it, but equally we want to prevent anyone who has it and is asymptomatic and not particularly unwell giving it to somebody else who is more vulnerable and more at risk.
Thank you. I think that's great. Okay, so I think that's probably our questions. So we're really grateful for people joining us today. So probably just to thank you all for joining. Our next Share and Learn is on the 13th of January, so next year. And we're going to hear a celebration of good practice at that event. So thank you, and I hope everybody's found that helpful. Thank you for joining. Have a good afternoon. Bye-bye.